Hi, my name is RITU SHAH, and here's why I think that mirror therapy is an overlooked tool that tricks brain to heal the body. So, what is mirror therapy? It's a simple but powerful neuro rehab technique which uses a mirror to simulate the movement in the paralyzed or missing limb. So, the goal is to stimulate the brain to see the movement happening in both the limbs and rebuild the neural pathways. And how it happens is a mirror is placed between the limbs. Say these are both of my arms, and the mirror is going to be placed in the middle. And the normal unaffected arm will be doing the movement. It will be reflected in the mirror, and the brain will perceive it as if both the arms are moving at the same time. And it's used in stroke rehab, phantom limb pain in case of amputation, CRPS, which is complex regional pain syndrome, or reflex sympathetic dystrophy, and pediatric cases and orthopedic post-operation cases. So, history and development. This technique was first developed by a neurologist, Dr. V.S. Ramachandran from India, for phantom limb pain in the amputees. And with time, it has spread to the rehabilitation protocol of stroke patients, cerebral palsy patients, and for chronic pain. It's a very low cost neurological training tool. And it was initially developed to non invasively trick the brain into believing that a paralyzed or missing limb was moving. So that enables the activation of mirror neurons and motor pathways. And in my experience as a PT, I have seen a lot of patients with stroke, and mirror therapy has really helped to improve their limb awareness and motor initiation. So it's an emotional motivation boost. To give you an example, I had a patient who had seen 4 or 5 physical therapists before me, and they were the prior function level was they were able to go to their office, they were able to cook food and so on. And after the stroke, they completely lost motor control of one arm. And it was really depressing for them, and they had given up on the exercises. But after mirror therapy, when they actually saw that their like visualizing both of their limbs moving at the same time was a hard hitting factor, and then when they achieved a minimal sort of movement in the affected limb, it was like, okay, a new ray of hope that they got. So now this arm is still alive, it can still do stuff, and I can still improve it, is the idea. So, which is why mirror therapy is used when patients have minimal or no active movement. So, this is to kickstart that active movement. And one patient had teared up the first time they literally saw their paralyzed hand move in the mirror. And this emotional response boosts the motivation. This is a video of a stroke patient getting mirror therapy done. And if you see, there are minor muscle activations in the affected hand, right there at her pinky finger. For amputees, mirror therapy has caused reduced phantom limb pain with daily sessions. So what they do is they place the mirror between the two limbs, and significant success using mirror therapy is achieved when you do it 10 to 15 minutes every day. Some patients reported that they could even move their missing limb again, which in turn reduced their pain episodes and anxiety. Basically, their brain perceives that the non-existent limb is also moving, and they can produce minor movements in the remaining part of their leg. Mirror therapy is of great use in pediatric populations for patients with cerebral palsy or hemiparesis because children love mirror games, like Simon says. It gives like visual feedback and also it's a wow factor. It keeps the children engaged in play therapy and helps improve bilateral coordination, body awareness, and even it creates confidence in the movements. I had a patient who would only focus on their dominant arm, which is the left arm, and would not use the right arm for any activities. So what we did is, after a lot of training with mirror therapy, we had tied up their dominant arm and they were able to use their non-dominant arm voluntarily after so many um, sessions of mirror therapy. I also wanted to share some amazing facts about mirror therapy. It can activate motor neurons in the non-moving limb. So, in cases where the patient feels like this arm is hopeless, this arm is dead, and a lot of physical therapists give up on that patient's arm, might or might not be able to revive movement in there. MRI studies show that mirror neurons are firing even in the immobilized side during mirror therapy. And children sometimes create new motor strategies through the visual illusion, something which is very hard for us to achieve consciously because we have to keep setting motor patterns, motor schema. But after mirror therapy, children tend to sometimes create completely new motor strategies. Emotion seems to enhance neuroplastic response. So patients who feel joy or fascination with mirror therapy often give a more positive result, progress faster. The strengths of mirror therapy, it's low cost, no tech is required, it's non-invasive and it's safe. It's effective for neuroplasticity stimulation. Neuroplasticity is making of the new neural pathways and adapting. Portable, simple, adaptable. It's good for all ages. It's good for pediatrics. It's good for geriatrics. It's good for middle age. And it's evidence based. It has stroke and phantom pain cases. The limitations are it requires visual and cognitive engagement, which means that it's going to be very difficult to explain this to somebody who has mental retardation or cognitive impairments or also visual impairments like blindness, or if they can't see properly, they're not going to be benefiting from mirror therapy that effectively. It's not effective in severe motor or again cognitive loss. Some might find it boring because you have to keep repeating the same actions over and over for the learning and the neural pathways to start reforming. And it's underutilized in tech heavy clinics because now everybody is running after gimmicks and new fads, and tech heavy clinics are not going to have mirror therapy as an option, and it's best as a supplemental tool and not the whole therapy in itself. When you compare mirror therapy with other tools, the cost is very low as compared to the VR and equipments used in a traditional PT clinic. Engagement, you get moderate engagement, whereas you get high engagement in VR, and it's dependable on the PT. Accessibility is very high in mirror therapy because all you need is a portable mirror, whereas VR requires setup and space. And traditional PT also has high accessibility. Brain activation is very strong in mirror therapy because fires up the mirror neurons, and it's equally strong in VR as well. And mirror therapy is best used in early rehab, whereas VR is used in mid to late rehab, and traditional PT is used all the time. My unique perspective is simplicity isn't a flaw, it's a feature. So, What I've noticed over the years is many young therapists dismiss mirror therapy as it's too simple or it's too old fashioned. That's a mistake. You can't be overlooking a tried and tested method as something which is too simple or, boring. Because in my clinical work, I've seen mirror therapy unlock neuroplastic change where more expensive interventions have failed. You will keep trying doing the electrotherapy, but sometimes something as simple as a mirror can produce more effects in the beginning stages at least. It's not about the tool, it's about how creatively you apply it. So I often combine it with verbal cueing, imagery, or even music to enhance the engagement. There was also an instance where I had a patient who was familiar with the Indian classical dance form called Bharatnatyam and Kathak, and basically I had them do mudras. So it's like that, and then there's different mudras where you do different actions, and it's really about creativity and how you take the course of the treatment. In pediatrics, I've turned it into a magic trick game with the kids, and it really helps. Like I said before, it's underutilized in modern clinics. Most clinics are focused on robotics, VR, or bioharness type tools. But mirror therapy, it costs almost nothing. It's portable and it's flexible for all ages and settings. You can use it however you want to, how creatively you can do it. And my final thought is it's not just a starter tool. If you're using it well, mirror therapy will become a gateway to re engagement, especially in cases of early rehab or complex neuro cases where you reach a standstill or like a plateau point and you want to achieve you want to achieve a minor result which is going to motivate the patient, and this might just be that. So, what is my conclusion? Do I endorse it? Yes, I do endorse it, but there are some conditions to it. I recommend mirror therapy as a supplementary neuro focused tool, which is especially in early rehab. But it's ideal for stroke, amputation, CRPS, and pediatrics because it's a low cost entry point into neuro rehab, especially for clinics with limited access to high tech tools. So, if you're looking to just start out, and you can't afford having extremely expensive technological tools, you can start easy, you can start basic, and you can still achieve a lot. My final verdict is it's not just about moving limbs, it's about reconnecting the brain to the body, the mind and body link, which we keep talking about. If used creatively, mirror therapy can unlock potential where other tools cannot. So this is a discussion. Have you ever used mirror therapy in practice, and how can it be modernized for today's rehab environment? Think about how today's generation, what problems they're facing, and what are the most common cases that you see where you think you can apply mirror therapy, and if at all it needs to be modernized for today's day rehab. There's also a scope of mirror therapy in unexpected populations which might not have heard of earlier. It can be used with chronic post surgical orthopedic patients to improve the movement confidence. Say the range of motion is not complete in the affected elbow and it's complete in the unaffected elbow. You can just, you know, show the patient, and they can the brain can perceive the movement happening, and it might actually gain you those extra um, degrees of range of motion. There's chronic pain clients like fibromyalgia who are demotivated because of the pain level, and you can get the movement kick started in those patients. The research on this field is still growing, but it's clinically really promising, and it could be the mind body bridge we need in holistic rehab, because in rehabilitation in itself, the definition is the whole well being, not just physical but also mental, also emotional. So this could be the mind body bridge that we all need.